Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by New Patients Incorporated and NPIClick.com. I'm Howie, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush. Hello, everybody. Welcome once again to our Dental Marketing Mastery Series podcast. We're so glad that you're out there. I'm Howie Horrocks here in Vegas, and my good buddy Mark is out in New Jersey. How you doing, Mark?
Hello, Howie. How are you?
I'm good.
All right, man. You staying in the house, being safe?
I am.
All right.
So today, this podcast is entitled "What You Should Be Doing Now."
Yeah, it's kind of sounds clickbaity.
Yeah, it does.
Yeah, it sounds like some promotion that some other company would do. We're not really known for clickbaity crap, but we do want you to pay attention to this because, as we've gone through this, I guess this is probably close to week 3 now, right? We've all experienced this mental, I don't know, these phases, right? It's kind of like when somebody that you know dies and you go through psychological phases. You have, I think it's denial, anger, sadness, maybe in that order, mourning.
Yeah.
So we've kind of been through all this. Like now we're 3 weeks in. Is anybody shocked by this? No, nobody's shocked by this, right? People are still concerned, obviously, and rightfully so. But eventually, all of us at different times are going to reach the point where we say to ourselves, I need to do something productive. I can't take another picture of my dog laying on his back with his fours up in the air and posting it on Facebook and asking all my friends if that's cute or what. Okay. Yeah. I just can't do that anymore. Right. And I've done all them puzzles and I figured out that all those numbers equal, 409 and all the crap. And I'm on dental forums and I got, you go on any dental forum anywhere and you got 1 to 1,000. You got one doom and gloom, I might as well just quit and move to the, to the scrub brush in Africa somewhere. And then you've got the 1,000, which is, I'm going to take advantage of this. It's going to be great. I'm going to make up all my money. We have pent up demand, blah, 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 and all that crap. So you have everything from 1 to 1,000. And we're going to try and keep you right in the middle. Which is where you need to be right now. Actually, if you're listening to this right now and you're still fearful, scared, and you don't really see any light at the end of the tunnel in your state for coming out of this, then maybe just pause this podcast until you get that feeling, oh, wait, there is light at the end of it. Yeah, there is testing for everybody. We are going to go back to work in a month or whatever happens to hit your state. And then we play this podcast because this podcast is about what you need to do right now in order to make sure you don't make an enormous mistake coming out of this thing. And I'm going to venture a guess that 90% of you, unless you listen to this podcast, will make this mistake. Okay? So this should be an important podcast. So here's what we need to do right now. We have a guide. If you go to New Patients Inc. / guides or learning center or somewhere on our website, we have a guide called Preappointing All Your Hygiene is Bad. It's probably, I've been in dentistry now for 30 years. I've never had more disdain thrown at me by hygienists in 30 years than after I wrote and published that guide.
Yeah.
So, yeah, because I'm changing their world and I'm moving their cheese and they don't like it. So that's tough noogies, because what I'm going to tell you is going to greatly enhance your practice as you come out of this. So if you haven't yet, in addition to this podcast, I want you to download that guide. I want you to read it and understand it. Because in order for you to do what I'm about to ask you to go do for your practice, having that base level understanding, you'll have a smile on your face if you do what I'm about to tell you to do. Okay? Because I'm not going to fill up this whole podcast with that content, because it would take like 2 hours to read that thing to you. So anyway, so here's what's going to happen when you open up the doors. Every dentist listening to this just canceled and moved. Actually, what you did is suspended animation. What? 100 appointments? 200 appointments? 500 appointments? Depends on the size of your practice. The reality is the number is greater than 0, right? And almost all of you, without question, pre-appoint hygiene. So you already have hygiene. Let's say we come out of this in May 15th. Let's say May 15th. Your state says, okay, you can not only do emergencies, but you can go back to being a dentist again. What's the first thing you're going to do? You're going to go rebook the patients that you moved, that you canceled, that you put into suspended animation. And where are those patients going to go? They're going to go in every conceivable available slot in your schedule from May 15th forward. And that's my point. How many new patients will you see between May 15th and June 15th if every conceivable slot in your schedule is filled up with the patients that you canceled and put into suspended animation? And the answer is 0. Because they won't have any place to go. And that's the reason for this podcast. This is what you can do now. So here's what I want you to do. I want you to go back to June 1st of 2019 to December 31st of 2019. And I'd like you to add up all the new patients you saw. Let's say you saw 150 new patients, or 120. Let's just make it easy. 120 new patients in 6 months. I want you to divide that by the 6 months that you analyzed. That means you have an average of 20 new patients a month between June and the end of December last year. 20. Just to maintain your new patient volume that you enjoyed last year, you need at least 20 slots for new patients from May 15th forward. Now, if you're saying to yourself, oh, okay, I'll just give them, 11:15 in the afternoon, to 1 or 12:15. Well, nobody wants that time slot. And by May 15th, you're not the only guy or gal going back to work. Guess who else is going back to work? Your patients. Okay. So if you're going to reserve 20 appointments a month for your newest patients, then you really need to go in and block. I'm not going to say the word block. I'm going to say the word paint, and I'll tell you why in a second. You need to color 20 primetime slots in your schedule from May 15th forward. Now remember, May 15th is a moving target. Nobody knows exactly what's going to happen in your state, what have you. So if it's June 15th, it's June 15th. If it's April 30th, it's April 30th. Move the date however you see fit. But start at like May 15th and paint, color as at least 20 slots during prime time. Don't select 11:15 a.m. New patients don't want that. New patients want the last appointment in the afternoon or the first appointment in the morning because they're going back to work and their kids are going back to school. Okay? Now, because you've had 3 weeks out and probably in another month you'll have 7 weeks out, you actually get to go out into your schedule. You have less appointments in your schedule right now than you probably have ever had in maybe the last 2 or 3 years, just because of this 3-week delay. There's 3 weeks of hygiene that you didn't book out 6 months from now. So you have more openings in your schedule right now than, you probably have ever had since you got this big. Go now. Secure at least 20 new patients appointments each month during prime times in your schedule. Yes, it's going to make the patients that you had to cancel wait another couple days. Yes, your existing patients that you had to move, they may have to come in at 11:15 in the morning. Okay. But here's what you're actually going to do, okay? You're actually going to start growing again, starting the first day you come back. Just taking care of your existing patients is not going to allow you to grow. You still need new blood in your practice, and that new blood needs to come in day one of this rebound. You can't afford to delay that for 60, 90 days and then all of a sudden panic because your schedule is empty because you just worked through all those patients that you moved and you paused. That is not the right way to do it, because I guarantee you 6 months from now or then, you're going to have a revenue dip. And you're going to say to yourself, dang, why didn't I do what that guy said on that podcast? Why didn't I reserve 20 or 22 slots a month based on my own numbers for the newest patients? Why didn't I do that? When I had all the time in the world and I was bored and I wanted to do something productive for my practice, why didn't I take the time and do that? So I'm trying to encourage all of you to go take a look at the last 6 months of new patients. Divide that number by 6, give yourself an average, and go paint that many openings, prime time, in your schedule from not only, let's say, May 15th forward, but if you want some extra credit or if you want extra benefit from this exercise, what you'll really do is you will paint 120% of your average. Because you don't want to just stay average. You want to grow. So let's take our example, 20. If you average 20 a month, you multiply that times 120%, and you end up with 24 spots that you need painted in your schedule during prime time for your newest patients only. It's okay if you get within 24 hours of that appointment and it's open. What's going to be the easiest appointment time to fill? You got it. The first one in the morning, the last one in the afternoon, with 2 months worth of patients that you had to cancel. But what happens if all those slots are filled with existing patients? What happens 6 months from then? And that's what we're trying to help you avoid. We're trying to help you. If you're going to rebound, if you're truly going to rebound, not make up for lost time. I'm saying rebounding. Okay, that's a different. Those two things are very different from each other. If you're going to rebound from this exercise alone, all by itself, will help you prepare to actually grow out of this, not stagnate out of this. If you don't do this exercise, I can almost assuredly guarantee you that your revenues will stagnate coming out of this. And most of you would really appreciate revenue growth over the next few months coming out of this. So, yeah, please, what you need to do right now is in that guide, New Patients Inc., Education Center. It's either called Preappointing All Hygiene is Bad, or we had a different title for it. I think it's
Something about
I think it's
bottlenecks.
no. It was 40 cost methods to improve your marketing. It's either one of those two titles.
Yeah, that's it.
Go onto our website. That's right. It was 40 cost or Preappointing All Your Hygiene is Bad. That's the title that got us in trouble with hygienists. They didn't even read it. They just yelled at me. They're like, "No, you suck." I was like, "No, not really. Like, you should look at the data." "No, I don't want to look at the data. I look at patients." Okay, whatever. Anyway, so that's something, doctors, look, that's something you can do right now, or if you're still employing your team or part of your team and you're looking for duties, that really useful, beneficial duties that they can do while you're still paying them, this is perfect. They can go out a year and pre-paint your schedule for your newest patients. This is a great way for them to spend their time for a big benefit for you down the road.
Yeah. Well, that's great, Mark. Thank you. And thank you all out there for listening. We hope you tune in again next time. Bye now. We hope you've enjoyed our podcast today. You can get all our podcasts on iTunes, Stitcher, and Libsyn.com, and on our websites newpatientsinc.com and npiclick.com.